Good afternoon, everyone. Thanks for joining. My name's Ben Gill, the head of customer success at OnePlanet, and will be leading the workshop, but handing over to other people to do most of the talking. We've set it up for a 2-hour session. The aim is for it to be less than that, but to give us plenty of time for conversation. So we'll be going through an introduction to aligning health and climate. We'll then have a breakout session focused on strategy, then be looking at some specific community action taking place in South London and having a session on the breakout session on that, and then have some time for wrap up and next steps. So for those that have joined, just a reminder, this is being recorded, so we can share it afterwards. So I hope that's okay. I think everyone has the ability to turn on their microphones. If you're happy, your microphone and camera, if you're happy to turn on your camera, it's always great to see faces, but please keep your microphones muted. If you have any questions, pop them in the chat and we'll try and deal with them as we go through. And afterwards, we'll be sharing the slides and actually sharing on OnePlanet all of the information that we've gathered during this workshop. So I think that's everything. I will now hand over to our panel. So we've got Puran from OnePlanet, who will make a brief introduction, then Alamede from Impact on Urban Health, Harry from City of Westminster, and Gaurav from OnePlanet, who will all give a little bit of an overview of how they see climate and health aligning. Puran, I think you're kicking off.
Thank you, everyone. So my name is Puran Desai. I'm founder of OnePlanet. Got a background in medical sciences, but have worked in sustainability for over 30 years. And for me, sustainability, or creating a regenerative future, a healthier future, a better future, is all about understanding that everything is interconnected. So, for example, what we build determines how much we use our cars. If those cars are internal combustion engine cars, they're creating pollutants damaging our health. They're also contributing to climate change, supporting the oil industry, which also creates single-use plastics, which are ending up in the oceans, filling our fish up with plastics. If we choose to eat those fish, we fill ourselves up with even more microplastics, and probably every cell in our body now has microplastics in it, damaging our health. But it's also killing penguins on the other side of the world. So everything is interconnected, and we're starting to realize just how interconnected that is. And so we need to start understanding, managing, visualizing, nurturing those connections. And we are we're really tearing our hair out at the moment, trying to deal with issues in silos. For example, we try and deal, say, with the cost of living crisis in a way that just makes the climate emergency worse. So we're never going to solve our complex interconnected problems working in those silos, thinking in that siloed way. Instead of that, can we take a deep breath? Can we get our heads out of the weeds? Can we start thinking about what are the outcomes we want to achieve? How do those fit together? Can we come up with a set of joined up, shared outcomes? And can we collaborate then on those shared outcomes across traditional silos, whether those are silos of different sectors, public sector, private sector, the community sector, different the silos of the organizations we're in, or even the silos within the same organization. Different departments are often of large organizations are not joined up. So can we be more connected? And our health and climate and our economy are all very interconnected. So we need those sorts of connected solutions, joined up solutions.
Thanks, Puran. And now Alamede.
Hello, thank you for inviting me. I'm Olamide Rahim. I'm a portfolio manager at Impact on Urban Health. For those who don't know, you might be aware of Guy's and St. Thomas Foundation, which is connected to the hospital, but also has 3 charities as well as Impact on Urban Health as an umbrella. And so within Impact on Urban Health, our aim is to sort of address the drivers of health inequalities. So working more so around preventative health. What are those drivers that could reduce, people developing long-term conditions or living unhealthy lives. So we do this across a range of areas, looking at how the built environment impacts families and children being able to access healthy, affordable foods, the housing structure and the capacity for people to be able to pay rent and actually afford to live a healthy life. We also look at the health effects of air pollution as one of the drivers of poor health outcomes and how that impacts on communities. And we also consider the stigmas that are attached to young people and children's behaviours, and often it's associated with the built environment again. So a lot of our work is focused around the South London boroughs of Lambeth and Southwark. And I think part of what we'll be discussing today is around like the South London, I guess, case study. And so wanted to share a bit of a summary of a fund that we ran from 2022. It's sort of ongoing up until the end of the summer. It was a community health and climate fund. And the intention there was to support 17 Black and Brown-led organisations that are in Lambeth and Southwark and who are operating across the intersections of health, climate and so the fund was sort of designed as a generative experience for those organisations, but also it was an opportunity for us in the foundation to better understand the experiences of communities as it relates to the climate crisis and the consequences of those. And so some of the highlights from the fund, having discussed and being exposed to more organisations working within the space, elements of this was around, again, sort of reiterating that Black and racialised communities are interested in the climate crisis and the consequences that it has. They're deeply concerned about them. They're aware of the heightened risks that it poses on their communities, whether it's the financial capacities to cope with climate shocks, whether it's floods, overheating, but it's also like the physical impacts that it has on communities. So the last heat waves that have been experienced, it often affects inner city areas, and Southwark in 2022 had one of the highest temperatures in the country, and this is where this is also affecting people's health essentially. So they want to be part of the solution as well. So being invited and included in building solutions is essential. And for that, there needs to be an understanding of the sort of sense of belonging being key. And so for communities and racialized groups who are often marginalized and have a history of being marginalized in this country, it's important that they are included, they are brought into conversations and engaged with to ensure that the solutions that are created address have an impact and have a benefit for the broader sector and society. The sort of final point to sort of highlight from our fund is around the support and resources that communities need. So they want to be a part of the solution. However, there needs to be sort of a greater sense of resources that are directed towards those groups. So prioritize community-led action from groups that are working on climate justice. Understand it and recognize that there are multiple different perspectives and they work within that way. I think it speaks to also the point about breaking down the silos. So seeing that there's an intersection of sort of, poverty alleviation, but also race equity and health equity that could lead to better solutions for all. That's what I have to share. Thanks.
Thanks, Olamide. That's Brilliant. And I think, particularly for myself, coming from very much an environmental background, this much deeper understanding of what climate justice means has just been really insightful, in that we're talking about health and climate, but health, climate and equity need to be resolved together. We can't address one without the other. So thanks very much. Harry, from City of Westminster.
Thanks, Ben. Afternoon, everyone. So I think, very much in line with everything that's been discussed already. I think here at Westminster, we've been really trying to sort of challenge our approach and our thinking around sort of climate action and embedding, and really trying to look at it as a people issue rather than strictly an environmental issue. And if we've got any colleagues from Newham Council, I must admit we have adopted one of your brilliant diagrams, which I think really shows that, in that climate has has such an impact on so many aspects of society, and as you can sort of see from that diagram there, I think it would be amiss if, especially for us as a council, all of our thinking was sort of very much with that carbon lens on, when there are so many opportunities to realise those co-benefits across so many aspects, as we've already discussed. And I think just looking at some of the stats that have been pulled out there, when we specifically look at sort of the impact on climate and health, it's really helped to sort of inform our approach to embedding across the council when we take this wider view of it. So if we just jump to the next slide, we've started to do a bit of that thinking in terms of how does our climate action plan sort of interlink with not only other environmental strategies across the council, but specifically when we look at health, how does it interlink with our public health strategy? We have a 2035 strategy at the council that we're developing, which is looking to address sort of life expectancy gaps across the borough, and sort of other interlinked strategies like our active Westminster strategy. So really looking forward to today's session. We're very much at sort of the start of that journey, but it's great to see so many people here sort of recognising the interconnectedness between health and climate.
Thanks, Harry. That's great, and it's been really interesting starting this work with Westminster, and particularly this 2035 strategy. You mentioned the disparity in life expectancy across the borough, which was again one of those really quite shocking but enlightening statistics. Gaurav.
Hi everyone, my name's Dr. Gaurav Sikka. I'm the health lead at OnePlanet. I've worked in healthcare for about 8-9 years as a junior doctor, particularly in primary care. But now I've redirected my efforts to help tackle what I see as the biggest threat to all of us, which is climate change. I mean, we could talk about the links between climate and health for ages, but I want to share some of the key insights from my perspective as a medical practitioner and environmentalist. So the first one is that, and I'm sure everyone realizes this to at least some extent, that climate and health are very closely linked to each other. The risks and opportunities with both issues has common drivers and levers. I think the most obvious example of this is diet. As we eat unhealthily, we damage ourselves and we damage the planet. So seeing these interconnections is critical to achieving progress in both areas. The other thing that sort of comes to mind from medical practice is that most people using up primary care resources in particular don't actually have a health issue as their primary complaint. Something like 95% of high resource users of diagnostics, medications, etc., have problems with social routes that primary care deals with in the best way it knows how, which is to kind of medicalize it, maybe over medicalize it. Examples of this are housing, poor diet, poor sleep, lack of a social network, which then quickly become medical problems. But our current sort of way of dealing with it, which is to tackle it so far downstream when patients present in GP surgery, is not health promoting, it's not efficient, and it's not a good trajectory that we're on at the moment. I think we can all agree. However, and some of this is from the learnings of, that we're going to talk about more today in Lambeth and Southwark. Community groups have the power to effectively and efficiently transform these environmental and social determinants. You don't need a medical degree to guide people to eat more healthily and exercise more. What you need, and actually we have loads of these in Lambeth and Southwark, some of which are with us today. What you need is community champions. And so I think what we could all be doing is supporting these champions to increase their reach. And really, I think now is the easiest and cheapest time to do it, as I'm sure we'll discuss. So yeah, that's all from me for now.
Brilliant, thanks, Gaurav. So yeah, that was the promise was we would keep the presentation short and focus really on the opportunity to discuss amongst ourselves. So we move on to the next part of the session, which I think myself and Tash, who is setting up the breakout rooms, have been nervous about for about 2 days. We're going to go into breakout rooms, hopefully with a good split between the health professionals, local government, private sector, to really have a discussion around what are the links between health and climate. Where do we see them? So we've had some of them mentioned just now. Do we need to address them simultaneously or not? Do people feel that's the best approach or not? And then are there any good examples of these strategies being aligned already that people can share? So hopefully when we go into breakout rooms, there'll be someone in each room who's there to facilitate the conversation. We've got about 20 minutes in the room, and then if we can, each group can feed back one important link that they see and one good practice example of strategy alignment. That would be helpful. We will try and gather all of the information that's discussed, all of the kind of key links and key strategies that are brought up in the groups, because as I mentioned at the beginning, we are going to plot all of this out onto OnePlanet as a way of sharing that back with you afterwards. So Tash, are we ready to send people into breakout rooms?
Yeah, we are. Okay.
Great.
Tash,
Well,
are people coming back? Yeah.
oh no.
Yeah.
No, I was just
You're
getting
too
my
slow.
point across. No. Well, anyway,
I've been told
look,
to stick to a strict
yeah, I didn't know.
timeline.
I think that we was going on for too long. But we'll have to take that offline, guys, at some point, because at some point we all need to be collaborating anyway. So we can talk about that another time. Thank you.
Now you've all come back in. There you go. Teams thinks it's really clever, but you've all come back in with your microphones on. So yeah, just a request, if you could all mute yourself, that would be great. But then yeah, if we've all got just take a minute with each group to feed back, and Nimesh, I'll let you off. I will carry on. So I actually had an impromptu breakout room in the main room with people who were waste and strays who arrived late or couldn't get into a breakout room. And Nimesh actually made the point around linking soil health and human health. That's a really, but food as a critical point of link between climate and health, but specifically soil health, and then maybe it's not a best practice example of joining up strategies, but the work engaging faith groups and interfaith forums on health and climate was something that Asha brought up, and I think was really interesting. Group James, was there someone from your group who wanted to feedback, or are you doing that?
I'm happy to feedback. Yeah. So Really interesting conversation. I think we touched on a couple of issues around kind of climate and health, very specifically around like some of the issues of extreme weather and how impactful that can be on hospitals that aren't set up well for heat in particular, and flooding. As I'm from Impacts on Urban Health as well, and guys in St Thomas Trust had an IT infrastructure critical incident during the 2022 heat wave, which kind of caused 2 to 3 months of delays to surgeries and similar, so, and hospital appointments. So which kind of brings in the reality of kind of how poorly equipped the healthcare industry can be to shocks such as that. And we also touched on kind of the housing and around kind of planning and the built environment, and how kind of a lot of our new builds we may be able to cater for in new design, but old housing stock that needs retrofitting in sustainable ways is obviously a huge challenge that everyone faces. I think there was a wide kind of acknowledgement that we do need to address them simultaneously. I'd be surprised if there are too many that disagree with that one. And then in terms of examples of good strategic alignment, there was mention of kind of the requirements for registered housing providers to achieve certain standards, but then touch on kind of the inequity of that same kind of standard doesn't then apply for private landlords in the same way. So there's kind of a bit of a disconnect. So something that there might be potential to explore. Also touched on kind of London Council's approach, where they've got 7 different work streams working across potential for climate adaptation that do look at the intersection of a lot of different issues. And there was one nod to the Westminster Environmental Justice Toolkit, but none of us knew enough just yet to comment. So looking forward to learning more about that one.
Thanks, James. Tash, your group, and not to but as a quick summary would be great.
Got it. We had a conversation about all sorts of different things, including movement of disease, vector-borne diseases, including what happens when the melting of ice might release prehistoric diseases, and particularly taking learnings from the pandemic into how we address the messaging with climate crisis. We also spoke about case studies around mangroves, wetlands, and treating all of those as infrastructure, which was interesting. We were wondering about the mechanisms to channel funding into that, and also, although it was sort of agreed that we should utilise the links between health and climate, particularly in order to get funding and in order to motivate people through their interest in health into climate action. You have to be careful not to sort of co-opt the health message. And one other point, there might also be sort of 2 different time frames in terms of immediate emergency versus chronic, a chronic timescale. So it's sort of getting the balance between those right with the messaging as well. Quite hard to compress 20 minutes conversation into a few breaths, but I think that'll do.
And I now muted myself and couldn't find it. Mark, does your group, are you feeding back, or have you got someone to?
Yeah, no, I'm the spokesperson. Yeah, we had a really interesting chat promptly on point 1, where obviously air quality is feeding into people's health. Obviously, increase in respiratory and cardiovascular diseases with the rising temperatures from air pollution. Also pointed out, longer periods with hay fever and allergies. These are also feeding into, obviously, as well, which we brought up, areas that are of poorer, demographics. Obviously, poor air quality, even poorer air quality in those areas. There's been feedback into obesity, also with old people with the heat or eat scenarios sometimes, whether it's the health or whether they're gonna eat today. So or keep themselves warm. Moving on to point 2, do we need to address them simultaneously or not? And I think we covered this quite well. Why wouldn't we address them simultaneously? Because climate is at the centre of everything, really. That's the bottom line that we came to. We didn't get to point 3, but I know Paul Allen from he did put a very good point. He had a very good example, which I'm going to chase up with him. But my room closed before I could write it down. So I'm going to get that from Paul. But yeah, a really good chat, some really good points raised by people. And one point that Joe was bringing up, which was correct, was the health and climate with eating red meat. We should be reducing our meat content, what that's doing for not just the environment, and also helping people change with education and showing them how both are connected, and potentially what could be the financial gain for people by not going to McDonald's or KFC every day for the lunch or evening meal. Yep, that's it.
Thanks, Mark. So if Paul put a note in the chat, we will be able to get that. Puran, your group.
We nominated Rosie, and we'll come back. We're following instructions. One link. We've got an interesting take on should we do them simultaneously, and one great example from Rosie. So I'm going to hand over to Rosie.
So yes, number one, when we were talking about the links between health and climate, one thing that came up with us was loneliness and isolation, and then by extension, mental health. We had Laura, who works for a retrofit company, who quite rightly brought up the impact that where people live, if the infrastructure is failing, if the cost of energy is prohibitive, then sort of, there can seriously impact on loneliness and isolation. But then we also discussed the importance of green social prescribing in tackling loneliness and isolation. I've seen it from work that I've done with teams in my council, just how beneficial it has been, particularly to people who are within the adult social care system, the importance and the benefit that you see when you can link them up with a walk and talk group, or you link them up with someone who's nearby and they walk together to go to a local cafe or something like that. The importance of the outside, it may not always be termed sort of climate or natural environment, but just going outside with someone for a chat or just getting them outside their home has been absolutely vital. And loneliness and isolation, particularly in older demographics, is such a big thing for us to try and tackle, particularly with community support. So it was really interesting to have that discussion. In terms of do we need to address the everything simultaneously? Obviously, we were just like, no, why on earth would we? Of course, that's absolutely nonsense. Working in silos, we know does not work. We need to work together. We need to, we're somewhat running out of time. We do need to address everything at the same time. But we also then talked about the scope, and the context in which we discuss things. So we took ULEZ as an example. We're going, right, well, who are we talking about when we discuss the impacts of ULEZ? Is it the immediate community? Or is it the people who are then going to be impacted by what ULEZ means? Going, right, okay, well, if we're now going to see a massive uptick in the creation of electric cars, electric transport, who does that then go on to impact? The natural resources and the supply chain of that, who's then impacted by that seeing a big boost? So we sort of talked about it in the net zero, so scopes 1, 2 and 3. Do we now need to start implementing that into other things that we discussed within sort of climate and health? And then number 3, examples of good strategy. I spoke about a program that we ran in my borough called the World Cafe program, ran for about 14 months, where we went round and created, because when you say you're doing something with the local council, everyone can sometimes be a bit, oh, that's going to be a bit starchy and boring. So we tried to create an actual pop-up cafe almost, where we had brought community groups together, resident groups together, any voluntary-led organisation across every single ward in our borough, to discuss any issue that the resident wanted to bring to the table. and we would talk to them individually, or we try and talk to them together as a group. And a big thing in terms of climate and health is that often we had younger people, so be looking in some, I think across the board it was some medium with some late teens, talking about climate and the impact it was having on them. And often if they were on the larger groups with people who were older, particularly sort of like middle-aged, sort of 65 plus, they weren't necessarily having climate at the forefront of their mind in terms of the issues they would bring to the table. But when it was brought to the table by sort of younger people, it then widened the conversation. So it was embracing a lot of different demographics in the conversation around climate. So we found that through the World Cafe programme, it's worked really well. And the outcome reports from those then went on to feed into adult social care and public health strategies locally. So we found that to work out really well.
Brilliant, thank you. So it's great we've had a different link mentioned each time, getting harder for each group, and thanks for the pop-up cafe feedback. Gora, your group or yourself?
So our link was very much based on food security in the Cayman Islands, which is, you know, maybe a bellwether sort of situation for the rest of us, that Melanie Carmichael was sharing. So we talked about how in the Cayman Islands, 100% of food practically is imported, and the food economy there is completely non-circular. And then we talked about how that rolls over into effects on people's health, and then circles back on making healthcare services even more incapable of looking after people. So you get these sort of spirals downwards that get created. So then we moved on to whether it should be sort of simultaneous or not, and we had an unequivocal and resounding yes. But there's always going to be times where you need to kind of prioritize, and I think that's where what we're talking about, a just transition, comes in. Someone putting their hand up, sorry, I didn't quite see. And part of that just transition is including all demographics and stakeholders. Yeah. And moving on to our good example, we didn't quite get to fully flesh this out. However, one of the things that we mentioned was green social prescribing. Rosie already talked about that, but from a strategy alignment point of view, through green social prescribing, you're aligning the needs of the planet, the person or patient, and the healthcare system. So we thought that was a good example too.
Brilliant, thank you. Harry is last. I don't know if everyone else's view has just gone to kind of cinema view, but I don't know why that's happened. Teams just keeps everyone on their toes, doesn't it, Harry? Yeah, the cinema is yours.
I'm completely flustered by the new view, the fact that every single one of my points I was going to raise has been ticked off by other people. Although it's great that I think we're all recognizing those links. Yeah, to be honest, I think a lot of what's been discussed by other groups also came up with us. I guess one of the interesting things that we talked about, I won't go through sort of the links, but we talked about the importance of sort of articulating this message, and that actually there's a lot of conversation sort of happening obviously between colleagues here today, but general perception is that perhaps at a resident level those connections aren't necessarily being made yet, and it's really important that we sort of articulate that in a way that they can understand and appreciate and link back to sort of their personal experiences. And like I say, I think one of the really interesting linked to that, we started talking, Lizzie in our group started saying about sort of the role that arts and culture can have in that, in terms of sort of how we reflect on societal impacts and sort of those key messages. And I think that was a really interesting conversation in terms of different mediums that we can use to bring forward that narrative, and that links to both climate and health. Another really great example, it was mentioned earlier about sort of the impact on mental health that climate has and climate anxiety. And I think Sarah and our group sort of reflected that they're doing a project where they, work with cultural leads to help connect people with nature. And it's been such an effective way of sort of delivering that message of sort of the benefits of nature and environment, both from a climate perspective, but also, like I say, from a sort of mental health and well-being. So, yeah, I've done my best to pull out some unique examples. I think everything else was covered by the groups prior.
I think you've done an excellent job, Harry, and I will go the groups in reverse order for the next breakout session. So, yeah. So thank you for that, everyone. I think that was really great, and as I say, pretty impressive that we did manage to have 7, as it turns out, kind of separate links made between health and climate, and also bringing in culture and the importance of personal experience. So we now want to move on from having taken that kind of strategic perspective and look at actually much more some really kind of concrete examples of how we can address health and climate together. I mean, just before that, I wanted to put this in some kind of London context, as it is London Climate Action Week. And one of the pieces of work we did just to do this was to look at the mayor's strategies around addressing health inequalities, equity and diversity, transport and environment. So to look at all of the goals of those strategies and start joining those up. And it was interesting, really, that improving air quality was placed as a key goal in all of those strategies. So yeah, that appears to be a way of kind of bringing together all these strategies, but also making sure that we're not repeating action in all of them. Is that if this is a key goal in all of these strategies, there should be one set of actions for delivering that, not 4. But I guess it's Rosie then wins by mentioning air quality in her group. So I'm going to hand over to Wayne from Together We Ride. If you're here, Wayne, you are.
I'm here.
Great. So if you can turn your camera on, that'd be great.
It's on. Can't you see me?
No, but no worries.
It's on. Let me turn it off and on again. Can you see me now?
Yeah, you're coming now. Yes, great. Hi, Wayne. So yeah, please tell us about Together We Ride.
Hi, good afternoon, everybody. I'm Wayne Francis. I'm the founder of Together We Ride. Can you move to the next slide, please? I'm not professional like you guys, so I need prompts. Okay, so Together We Ride, who we are and what we do. So basically, what we do is we use cycling as a means or a driver to help people promote their health and their well-being. We also have been trying to improve diversity within the cycling space. When you're out there, you notice that it's more swayed to more European people, but there's so much benefits with cycling. What we are trying to do is actually get more Black and brown people into that. Next slide, please. Okay, so just a little story so I can give you a backstory of why I started Together We Ride. So during the lockdown, many of us, we kind of had some form of adversity. Mine was health related. I was really stressed out. I wasn't enjoying my job. I was working from home. I had my little one at home as well. And I was trying to homeschool her. I'm not the academic type, and that was stressing me out as well. As you can see from the picture on the left, I also put on a lot of weight, and it got to a point where all of those factors was just really, really getting me down. So I wanted to find a means of just trying to escape it. I don't think I was looking at my health at the time. We had to be in our homes, but we could get out by ourselves. So I got myself a bike, and through that, I just started to get fitter and fitter in terms of just being able to cycle longer and cycle further. And as time kind of progressed, I just started losing weight. I didn't change my diet at the time. I was taking one step at a time, but I actually went from picture A to picture B very, very quickly. And at the time, it was like, do you know what? I know many other people are going through some of the trials and tribulations like myself, and I want to share this. I want to get out there, and I want people to get their bike. You know, my saying, if you look at our social media at some point, is get a bike, meet new people, do things, and go to places. And doing that, people are not actually thinking about, oh, they're doing exercise. We're just doing things fun. And I just started to get really, really healthy. And we've grown exponentially now from one member to over 200 members across London. And we're using cycling to actually get that message out there. Can you move to the next slide, please? Okay. So what our current goals are, you see, we cycling itself is something that a lot of people are transitioning into. Even, you know, when I'm looking at the infrastructure and how things are changing, you know, things are changing to actually increase more cycling, and that's what we want to do. But what we also want to focus on again is looking at those individuals that are not actually out there cycling and give them the skills to get out there, join clubs like TWR or join communities like TWR so they can actually live a healthier lifestyle. You know, one of the things that I like, or since talking to these guys from OnePlanet, is that there's a way that we can actually align all of our objectives and our priorities, because the outcomes are the same. You know, we actually want to have healthier people. And how do we do that? We can't really do that working in silos. You know, before joining this kind of group and linking up with Impact on Urban Health, I actually couldn't break through certain doors. I couldn't have conversations with people because I'm an individual, and sending a random email to a counselor, they're not really going to kind of, you know, really answer. And if they do, it doesn't really go anywhere. But when you're working together, it actually opens up a lot more doors, and collaboration, you know, is the way forward. So this is one of the reasons why that I'm definitely, you know, involved with Impact Urban Health, OnePlanet. The conversation that I've been having with Gaurav and Puran, they've just helped me immensely. And even coming here today, you know, as much as I'll be nervous talking to people because it's not my kind of scene, I know at the end of the day, we all want to kind of prioritize the health and welfare of the people that we serve. Okay. Can you go to the next slide, please? Now, OnePlanet, as I said, you know, I went for a demonstration of OnePlanet, and before going to that demonstration, it's just like, as everybody might see, oh, people are just trying to sell you something. Although I wasn't buying because I don't have the money for it, it was like, okay, I'm going to turn up. But in fact, when I actually sat down in the room, and I believe it was Gaurav that went through what OnePlanet is, the mind mapping, I was kind of astonished, because when I'm trying to look at, again, what the priorities and outcomes of, say, the Borough Lambeth and Southwark, I have to drill down and read so much information. I'm just like, okay, I can't get it all in. But with these mind maps and being able to see what boroughs are doing, what their agendas are, and how we actually all are trying to do the same things, it's a no-brainer. I just basically see OnePlanet as a one-stop shop, and it just allows me to collaborate. It allows me to meet, and hopefully it allows me to actually join the dots together. And again, we all are looking at the same outcomes, and to meet you guys and to see if we're able to work together to produce positive outcomes for everybody, you know, high, low, and medium. And that's something that I just want to achieve. But yeah, this is what OnePlanet has done for me, and this is what the, you know, the fund that I was able to access through Impact and Urban Health, you know, I was able to build capability for TWR, for us to go out in the community, and we do this off our own back 3 days a week, and ensure that, you know, we bring people together socially, they have a healthy lifestyle, and we're actually getting to view our city and surrounding places on our bikes and have longer lasting health outcomes. That's me. Thank you.
Well, Hayden, thanks so much. That was brilliant. Lovely personal story, but also just to hear the impact of that. Just to talk about, the benefits of getting out, meeting people. There is Asha here, who's also a Merton resident and working in the climate and health community space. So we should definitely hook you up as well to get in touch. Brilliant. So just one other view on the community perspective. Charlie just realized he's about to start speaking. Are you? There we go. You've got your camera on. Over to you.
Yeah, can you hear me? You can. Excellent, because it wasn't working earlier. Thanks, Wayne. That was excellent. So I'm Charlie from the Brixton Project, where we are an imagination-centered community organisation working at the sort of intersection of people, place and purpose. And we're working with OnePlanet, an impact on urban health, together with people like Wayne, to road test the environment and see how it can be really applicable in community. We work largely in the London boroughs of Lambeth and Southwark. And what I'd like to do, if it's all right, is spend a couple of minutes talking about story, and particularly because it's London Climate Week, in the context of community. I see so many parallels between climate and community activism. The defining challenges are complex. They're completely intersecting, and they're also really prone to siloed responses. There are so many barriers to meaningful action. Neither sort of issue, if you like, is anywhere close to being effectively addressed. They're both kind of macro and microcosmic reflections of each other. And the actions to address both, I think, ask us to rip up our old story of what constitutes progress, success, prosperity, and security. And I think deep down, we all know that we're sleepwalking into a perfect storm of climate, health, and wider economic and democratic crisis. And that much is evident whether you're at COP or standing on Cold Harbour Lane. But the facts are failing to motivate action at anything like the scale required. And it's no surprise, is it? Because the old tale of capital is that there is no alternative. And everywhere I go, whether it's climate or community, I'm hearing we need a new story, or we have to join the dots. Yet society seems frozen like rabbits in the headlights of these intersecting crises. We're incapable of articulating that better story, let alone taking the steps to get there. And I wonder whether that's sometimes because there are so many people talking rather than actually doing. It's as if a story is something that has to be passively consumed, read, watched, listened to. It's as if we're collectively holding our breath, waiting for someone else to write the magic combination of the best words in the best order, and that then everything will somehow be okay. But I think that's part of the old story that needs replacing. Somebody coming to rescue us, because no one's coming to rescue us. We know that in our heart of hearts about the climate, and we viscerally live that on the streets of Brixton or Peckham as the homelessness, the mental health issues, the drug taking, the destitution increases by the day. And all the while, we're fed consistently a story of personal responsibility and personal achievement. It's isolated and disconnected from each other and from the non-human world. That kind of mantra of there is no such thing as society, it might be 50 years old, but it's alive and well. And its favourite story is The Carbon Footprint. It's a bestseller written by BP. But if a new story is a thing not told but enacted, what does action actually look like for community, health or climate? And the Brixton Project believes it's something like this. So first, we need to shift our imagination from a place of competition to collaboration. Then, community needs to move from feeling powerless to powerful. And finally, institutions have got to navigate a transition from being top-down to meaningfully bottom-up. The knowledge, resource and capacity in the system must be deployed in service to what people actually need. But to do any of that, the first thing we've got to do is meet each other, to convene across discipline and demographic, so that we kind of really understand what we as community are capable of, where our shared purpose lies and our shareable skills and resources. The first step to change perhaps is knowing that things need to change, but the next crucial one is understanding that everybody else knows that too, and that we can collaborate. And so if we kind of gather change makers of all kinds together to work in concert, that's the key, I think, for us being far greater than the sum of our parts. And if we gather together around imagination, that allows us to create the conditions for the new stories we so desperately need to take root and then flourish. Because ultimately, for me, and I think for the Brixton Project, and hopefully for this interaction with OnePlanet and impact on urban health, community is resilience. Community is interconnection. It is looking after each other. And that's the polar opposite of the current story. And it's exactly what the world will increasingly demand of us. And so what OnePlanet is doing, and we saw a brief glimpse of that in Wayne's presentation, for us in the Brixton Project, is providing a really vital community building tool. It's quite literally a way for us in Lambeth and Southwark to join those dots. And as we know from our dim and distant childhoods, you start joining the dots and you very soon get to see the bigger picture.
Struggling to unmute myself. Brilliant. Thank you very much, Charlie, for that a very clear vision of how we move from where we are today. I love 3 points. I love 3 points. Very easy to grasp hold of, but moving our imagination to one of collaboration and actually community feeling powerful, and taking a bottom up approach is really one way that we can then enable community to start addressing these issues of health, climate, or equity all together. So hopefully we're going to be able to move into a second breakout session. Tash managed that amazingly the first time. So the goal is we really want to look at take a really specific example. So I mean, Wayne, I think, gave everyone a really sort of brilliant example of how one person can create a community project that impacts many people and improves the well-being of many people, but also addresses climate change for many people. But I think that point of, like, if he contacts the councillor, nothing happens. If a group contacts the councillor, that begins to make a difference. So we know that is contributing to climate and health goals. So how could we support Wayne more? And by we're going to break into groups that are local government, regional government, national government, private sector, and the health sector. And so what can we in that group do to help Wayne have more impact, to help Together We Ride be more impactful? And then also think about, if we can start getting that support to Wayne and Together We Ride, what more could he be doing? Are there other issues that he could help address by rolling them in together? So that's the plan. Tash, and again, we'll take 20 minutes, so we're pretty much on time. So at about 22, we will wrap up and come back in. And yes, if you can then feedback one way that your group could help Wayne, and one thing you think Wayne and will be able to help you with. If you can open the breakout rooms, I will remain here for any waifs and strays.
At least I didn't get cut off mid-conversation this time.
So I hope we're all coming back slowly, and I hope there were fewer waifs and strays this time, which meant but Marilla and Asher and I were able to have a good conversation. Right, who have we got? I think not everyone. There's fewer people. No, I think there's still rooms coming back. But seeing the time and knowing that do want to make sure we actually get to finish on time. Going to launch into feedback, but Harry, yes, please. You've got a minute on how you can support Together We Ride and how Together We Ride can support you. And I might jump in if you're too long.
That's fine. I've actually delegated to Sarah. Sarah had all the good ideas in our group.
And apologies, Harry, for telling you to leave the group and probably having to rejoin. But my skills with Teams. Yeah, so it's just Harry and myself, and we were talking about how OnePlanet can be really useful. It was great, Wayne, to hear your example of how challenging it can be when you're trying to set up a project and find funding resources and people that can help you with that, and that way into councils or health bodies, and how OnePlanet was really helpful for you, not to have to wade through documents, but to be able to pinpoint the key priorities so that you can then focus your message to make sure that you're covering those key messages. Got a bit of feedback on the thing, so I'm not sure if everyone's muted, but and the ways that we can support and we can would want support is in our first breakout room we talked a lot about making sure our messaging and our communications are accessible, and sometimes talking about climate can be a barrier, and so working with local groups that are delivering on the ground can really help us make sure that we're having the right messaging that's tailored to, that people can understand, and so we can get your feedback on how can we talk to people about climate, and by working with groups like yours, Francis, we can also help support. Obviously, your key focus and aim is about health benefits, and as a council, we might be thinking, well, this is also an opportunity to talk to people about the climate, air quality, etc. And we can help give you the confidence to have those conversations with people in your group. So it's a two-way process, really. We can help support you, but also we need your support in making sure that we're tailoring those messages correctly to the people that you work with, because you know them better than we do. Is there anything you wanted to add to that, Harry?
Yeah, I think just in terms of that facilitator role, we discussed about actually as a council, one, there's potential sort of seed funding opportunities and being able to support some of the work that you're doing, but also we usually have connections either to other partners or aware of other support networks. And I think Sarah, you said about actually being able to put different groups in touch with each other where there's examples of best practice, or you're trying to do sort of similar kinds of work. And then I know from my personal perspective, at the council, we're trying to do our sustainable transport strategy, for example, and it's utilizing groups like yourself, like Together We Ride, to one, inform our approach, but ensure that your views are being heard and properly built into our thinking, and cannot underplay the importance of that. So yeah, just building on that two-way relationship, and how can we as a council best facilitate and support the work that you're trying to do.
Thanks, Harry. Thanks, Sarah. Gaurav.
Yeah, so how can we support Together We Ride? The first, and I think most obvious one, is by being a springboard in terms of publicity and access to networks, so that you can, using the more basic levers like social media and comms campaigns, but then also helping nurture partnerships between Together We Ride and maybe somebody mentioned like a Ghanaian community group in our group. Maybe that's a way for Together We Ride to get more members in. Another one is to access expertise that can act as like testimonials or lobbying, so that Wayne might say, oh, this is really good for your health, but if we can get professors and doctors to agree with him, well, that's gonna or be other signatories on his letters, that may also be a very powerful thing to do. Next, we talked about access to data. You know, could we say, okay, Together We Ride, you're doing a fantastic job, but there's actually even more need for this group of people or that group of people. Can we put you in touch with them because we're having a particular trouble, you know, reducing obesity in a particular ward or postcode, whatever it might be. Next, we talked about
final point, Gaurav, if that's okay.
Okay, final point. The final point was that it might be helpful if groups like Together We Ride came together into a kind of digital yellow pages, so that if you were just looking for things to do, you only have one place to go that you need to go to find it, and thereby, you know, the listings being greater than the sum of their parts by being in the same place.
Brilliant, thank you. And Gaurav was the health sector, I think, if I'm right. And Puran, you are central government, if I'm not mistaken.
No, Rosie is central government again.
Brilliant, Rosie. And yeah, if you can just give one point given the time. Thank you very much.
Yeah, I will be very quickly. So essentially, our conversation boiled down to agreeing with so many of the points that Wayne and Charlie were saying, that it needs to be sort of a grassroots movement for central government. It can't be dictatorial. You need to recognise the impact that grassroots movements have and the importance of context and you know, location and the people involved in that. Essentially, we came up with this, and with OnePlanet being the connector between central government and community groups, in that we're looking at quantitative and qualitative. Now, also, if you're not involved in that, those words themselves can be very distancing, because you know, if it's not part of your general lexicon, you might be going, what does that mean again? So essentially, we came up with numbery and feely. Central government is numbery. They like things in numbers, they like statistics, they like data. If you're doing something within the community, it's going to be feely. You're going to be getting first-hand account. You're going to be feeling what you're doing on a daily basis. So you see the way that Wayne was talking about Together We Ride. You can see the passion that he has. You can feel it in his voice. So you need to find a way to connect those, because particularly with central government, they'll want to know, so right, brass tacks, what are you going to be saving us? What impact is this having? Give us numbers. Now, if you're doing that and you don't necessarily have an experience in providing that data from a local, from a community perspective, you're going to be slightly stuck in convincing them that this is a good thing to do. And that's where OnePlanet can come in, and it can be there to go, right, we can take the feely and turn it numbery. And then by extension, you can start turning the numbery into understanding and accepting the feely as a valid method of looking at the benefits that are coming from the wonderful community-led action that we're seeing across the country. So yeah, and done.
Thank you, Rosie, and I can't wait to see numbery and feely in sort of government strategies going forward. Brilliant. Mark, your group.
Yeah, local government, we kind of had a bit of a cheat, as I said, in our group, because we had Wayne involved, so that was good. So he was telling us exactly what he needed, so we were lucky there. I think the main thing that identify ways how your group can support TWR. Wayne's main point was collaboration with schools. From his feedback, and this is the same in a lot of different areas, is children, they're the catalyst for this, for change, for health, for climate. They understand that, you know, that children are not they're very, very more savvy than they used to be years ago. Well, when I was a kid, or that might have just been me. But like Wayne was saying, if local government can help with him getting into schools and being able to provide that, his services for children, these are the ones that will make the change. These are the ones kids will make parents get out on exercise, get out on the bikes and buy them a bike, go out cycling out with their friends. This is where it starts, and he was totally right. It was a really good to hear that. You know, and also what was good was with our group, Wayne's also found out some other ways of potential funding through community groups, especially in Westminster, and there's some really good collaboration of how funding can help him. Obviously, with things like if we get into schools, what can TWR provide for local government? You know, what it's a two-way street at the end of the day. Let's be honest. You know, by getting into schools, by when and TWR get into those schools, you know, you helping we collaborate with public health campaigns, promoting that physical activity, mental health, well-being. All these are improving by TWR getting through the door. So
Brilliant.
Yeah.
So that's great. Thank you much. So we're going to help get Wayne into schools, particularly in Westminster.
We're going to get him into every school in London after this.
Tash, if you've got just a minute, would be fantastic.
Yep. So we had actually more people focused on local government and authorities than private sector. So it was a bit of a mix in our group. But we were thinking about basically the relationships between these grassroots organisations and the local authorities or the private businesses which could support them, and how to navigate those relationships so that the grassroots organisations don't get swallowed up or lose their messaging, or are then less able to deliver what they've already been doing. We did, Biplav, I don't know if you want to speak a little bit about the idea you had around getting Together We Ride into consultation with the infrastructure team.
Yeah, I think it is more about firstly coordinating with different stakeholders, like in Haringey, the active travel team, and then maybe there are other teams in different boroughs as well. And then once that's done, we can have like different programs in different boroughs at different events or different moments of different months. And once that's done, we can actually, Together We Ride, members from Together We Ride can actually help in consultations to enable or to, make policies or programs for better infrastructure, cycling infrastructure, or the ecosystem that we actually need, because they're going to have a lot of users, and we need those kind of information from actual users in order to drive that policy or programs. So that was that was what I was saying. And then also we sometimes also provide like free cycle and stuff. So maybe we can top it off with like a membership with TWR, so that people who are receiving free cycles from Haringey Council can also be a member, and then also have that opportunity to socially cycle with different people. So yeah, it was around that.
Brilliant. Thank you. Thank you, Biplav. And Wayne's going to be rushed off his feet after this. So James, just before you feedback your group, I was just going to let people know that we will be putting all of this information onto OnePlanet to share in that way. We'll share the slides obviously as well. So if you haven't got an account, create an account, and then you'll be able to see all of this plotted out. If you'd like to learn more about OnePlanet and climate and health, we're going to do a webinar, much more about how OnePlanet works and how you could use that. July the 23rd, end of the month. And just as we're aware, there is an election next week. And if you're interested to see what everyone's promising in their manifestos, we have mapped those out on OnePlanet to show what the different promises are. And we're just doing a little apolitical session on that next week, if you still haven't decided who to vote for. But James, if you're still there, I'm happy to feedback on your group and also just give your overall thoughts from impact on urban health perspective. That would be fantastic. And sorry,
Yeah,
you've
certainly.
only got a minute or two left.
Yeah, no, that's fine. Challenge accepted. Just very quickly on the for Wayne's benefit, I think a couple of bits that will that build on a lot of the ideas that were mentioned there. We had a really nice example of Waltham Forest and their the work they've done to create kind of a Millie Holland environment, and they've actually just launched a new walking and active travel grant scheme or fund. So I think looking for opportunities like that where there are funding opportunities from local authorities could be really helpful. Also on the schools piece, we're kind of giving away our ages a little bit here, but we were talking about cycling proficiency and what that looks like now in schools, and whether that's something that is still ongoing or is something that that you could move into, and also the connection between kind of the hyperlocal, the local, the regional, and the national. If there's a at a regional level, you've got kind of you've got an active travel commissioner. You've also got a national active travel commissioner. So there's like there are links throughout kind of the pathways for influence that would be interesting. And all I say in a wider summary is we've got a fantastic opportunity here to make change. And I think too often health in its own right has not been enough for us as a society to do something about it from a preventative perspective, but climate change is the catalyst. We've been looking forward to actually do that, which sounds sad, but I think equally it is a huge opportunity and something we should be excited about the challenge to be able to overcome. And I'm personally really looking forward to working with OnePlanet and collaborating with as many organisations as we can to try and tackle the climate and health crisis that we're in at the moment.
Brilliant. Thank you very much for that summary, James. It is 4 o'clock. Thank you very much for staying. I said, do drop us if you've got any questions or any feedback. Do drop us a message, and we'll get back to you. We will be sharing the slides and the other information. And just thank you very much for all of your time and input today. It was a really great session, and obviously particularly thank you for our external input. So Wayne, Charlie, and Olamide and James really appreciated that, and Harry. So thank you very much, everyone, and we'll be in touch.
Thank you, guys. Bye.
Thank you. Bye.
Thanks,
Thank
everyone.
you. Bye bye.